Welcome to Spine Academy. This video is an excerpt from a larger course on a topic in cervical spondylosis. If you're interested in seeing the full course, we've left a link in the description. So to this point in our discussion of clinical evaluation, we've talked about obtaining a good history and performing a good physical exam. So by the end of that, what you really want to have accomplished is have some sense of what types of symptoms your patient has and whether there's any kind of physical exam findings that support that. Now, once you have done that and you have a sense of like this person sounds like they have a C6 radiculopathy, they have mild myelopathy, etc. Once you've done that, it's time to get into the imaging. And I usually won't go into a room having evaluated the imaging first, but rather evaluate the imaging once I have a sense of what's happening with the patient. So Chapter 2 really discusses cervical spine imaging in much greater detail if you're unfamiliar with it, and I'd encourage you to watch that if any of this seems unfamiliar. But we'll bring up an image here of a cervical spine MRI. This is a T2 sagittal image, and you can see here how this is really good for looking at the discs, it's good for looking at the spinal cord over here. On some sequences you can see the nerves very well. You can see the fluid around the spinal cord, this white stuff over here. You can see it kind of all the way down here and its absence over here. You can also see a little bit of swelling within the spinal cord over there. All of that is what an MRI is really good for. Good for looking at soft tissue, good for looking at fluid, so that's good for the spinal cord, the discs, things like that. If you had to look at only one study, it would be the MRI scan. But a question that people often ask me when they come in with an MRI is, well, why do I have to get a CAT scan if I have an MRI? And a CAT scan is a study that looks at the bones. So for example, this sequence here, you can kind of see the vertebral bodies themselves. This person has a lot of arthritic disease at multiple levels. There's a little bit of a step off right here, maybe a little bit of a step off at these other levels. They have a bit of kyphosis, which is that leaning forward that we spoke about in Chapter 3. All of that is stuff you can evaluate incredibly well with the CAT scan. You can look for fractures, other bony abnormalities, but you really can't see the spinal cord at all. So you can see the bones very well. The MRI, you can see everything really well except the bones. So between the MRI and the CAT scan, you can have a fairly comprehensive view of what's going on with the cervical spine. Both of these studies are done though, MRI and CT, with people lying flat as a general rule. So I often get, as a last study, routinely dynamic x-rays. So those are films done leaning forward and leaning back, and here you can kind of see, it gives you a sense of what people's range of motion is, gives you a sense of what they look like when they're actually load bearing, when they're standing up, helps you see if there's any instability, what their global alignment is like, etc. So those are the three studies that I get routinely when I'm evaluating people from a surgical perspective with cervical spondylosis. Now, when you look at those, really the priorities are a couple. Of course, it's useful to kind of go through everything. So just understanding the structural condition of the cervical spine is valuable, and that's great. But what you're really trying to do as a clinician is you're trying to correlate the symptoms and the exam findings with structural findings on the imaging. So if somebody who comes in with, say, symptoms where you're pretty convinced they have a C6 radiculopathy, you're going to look at the C5-6 foramen and see how the nerve looks, make sure it makes sense. If they have right-sided symptoms, they need to have right-sided pathology, etc. And try to correlate those so that their exam and their history correlates with the imaging. That's very important in trying to identify causation, or to be able to say like, yeah, that structural problem is causing this person's symptoms. So when I do look at the imaging, although I look at everything, I really am paying particular attention to making sense of the imaging relative to the symptoms and the physical exam that I have obtained already. Thank you for watching this video. I hope you found it informative. If you've enjoyed it, please like and subscribe. If you have any questions, comments, or ideas for future content, we'd welcome them in the comment section below.